Okay, so for the sacroiliac mobilizations, remember, what we're looking at here is a sacrum, right? So we're looking at our sacrum, and we're appreciating that the sacrum moves primarily along oblique axes, right? But the primary motion that a sacrum engages in is typically flexion and extension, right? More sagittal plane. So we talked about trying to kind of push on that, and our mobilization may consist simply of the patient prone, and you just pushing on those spots on the sacrum. Remember we talked about the 6 different spots you can push on? We could do it that way. My opinion, right? I mean, if I know the sacrum moves and is coupled with the lumbar spine, it makes sense to me if we're going to push on the sacrum and try to get it to move, that we should take advantage of that coupled relationship. So if I can have him sitting and lock in those ischial tubes, so that reduces motion of the innominate, and I know that as the lumbar spine moves, the sacrum moves along with it, and that's nice for me because I don't have to work as hard. It's not like he's laying there passively and I'm pushing on him. Furthermore, just like we did with Devin, right? The exact technique we did with Devin is what I'm showing you now. Just like with Devin, when she moved and she had pain, I can immediately prove the efficacy of my mobilization. It's not like Devin said, okay, that hurts. Okay, now lay prone, let me push on you, and now sit back up again and do it again. Literally, she's doing the painful motion while I'm pushing. So I immediately know if what I'm doing is effective. Well, how do you know? Because her pain's gone. Well, how do you know you moved it? I don't know what I'm doing. I may be blocking it, but her pain is gone. Is that significant? Yeah, that's what brought her in. It's significant. It's important, right? It's important to her. So it's nice to, again, you can do these techniques in prone and you can push on, and really they're the same sacral techniques that we did for assessment. Or my opinion is we can get that patient in a seated position and do it really nicely. Sometimes I do it in a standing position. Sitting is nice because they're sitting on the ischial tube, so it reduces motion of the innominate. They can really focus on the sacrum. Okay? So the 2 places that I'm going to push are going to be either at the base of the sacrum, which is between those PSIacs, or at the apex of the sacrum, right? Right above SC, okay? So I'm pushing either here or I'm pushing here. I'm going to push here at the base to get that sacrum to do what? To flex. What motion did we talk about, although we didn't agree, all of us completely, facilitates sacral flexion? Extension, right? So if I extend, the sacrum's going to do that. So all I'm doing, right, I'm taking that little kindergartner and I'm just patting her on the bum and helping her get on the school bus, right? I'm just moving that joint along. I always like in joint mobilization to kind of just coming along the joint and encouraging the joint to do what it was designed to do anyway. You're not trying to force it in any direction. You're not taking the kindergartner and drop kicking her onto the bus. You're not throwing her through the window of the bus. You're just simply kind of, come on, it's time to go to school, right? So that's what you're doing. So that's what you're doing with the sacrum. Sacrum is going to flex anyway when I extend. So it's going to do this, but maybe it's not doing it like it should. So I'm just going to come alongside and help it. So I'm going to push at the base to facilitate that. So they extend, and I push at the base of the sacrum at the same time. You can oscillate, you can hold at end range. Typically I'll hold it 5 seconds, 3 to 5 seconds at end range, and then they come back, and I hold the whole time. So I'm holding as they go, holding at end range, holding all the way back, and then I release. Okay? If I'm trying to get that sacrum to extend, then I have them slump. Right? So they're not bending like bending at the waist, like forward bending. I have them kind of slump. Right? So they're flexing, but they're doing it by slumping. So as they slump, I know that sacrum is going to go into extension. So where am I going to push then? At the apex, right? I'm pushing at that apex to kind of facilitate sacral extension. Okay? So it's the same exact thing, and the indications are if a sit to slump test is positive, and when I kind of engage that sacrum and it reduces symptoms, that's my chief indication that this is a good way to go. Okay, so what I'm doing is I'm going to do thumb over thumb. So I do my dummy thumb on the base of the sacrum, my mobilizing thumb over it, and I'm going to apply force in that fashion. A lot of times I'll use the Mophone to facilitate. Sometimes when your thumbs are getting beaten up, I might use the distal pisiform and kind of grab the patient, like you saw me do with Devin. So I might do that as well. So I'm just basically between his PSIacs, thumb over thumb, right at the base of the sacrum, okay? And now I'm going to apply force, I'm going to push, and I'm going to ask him with his hands across his chest to nice and easy anteriorly rotate your pelvis and kind of extend for me. And tell him, pretend almost like there's a string at your sternum and somebody's pulling up from the ceiling, pulling up that string. So you're going into extension. I'll hold at end range, 5 seconds, come on back, hold it all the way back, and then I release. Okay, I might do 3 to 5 of those. So I push, go ahead into extension, pushing the whole time. Hold, hold, hold. 2, 3, 4, 5. Still pushing, come back. Still pushing, still pushing. Now I release. Okay, I may not be comfortable. Thumbs get beat up a little bit. I've more recently started taking to kind of doing this. So now I'm in here like this. I'm holding the pelvis. This gives me a little bit better of some contact here. And now as he goes into extension, go ahead and go. I'm right here, and I can give him some pretty decent force. And I'm stabilizing nicely at the front, so I'm not pushing him off the table. And then go ahead and come back, and then I release. Okay, and then we do the same exact technique, basically, at the apex. So here we are. So now I'm at the apex of the sacrum, and now I'm going to have him in that position, just kind of slump and kind of flex. And as he does that, I'm pushing, and you actually feel the sacrum, the apex almost starts to duck underneath. And I just kind of follow that, kind of go along for the ride. I'll change that, my position a little bit, hold on to that, and come on back up, and then release.